Hello, my 10 tips to patients seeking hair transplant surgery and hair loss management. What to do, when to do, how to do, and many more questions I will answer in the next 10 minutes. I am Dr. Venkataram Mysore, hair transplant surgeon, dermatologist, Venkat Center for Skin, ENT and Plastic Surgery, Vijayanagar, Banashankari, Cunningham Road, Bangalore. What are these 10 points? 1. Know about your condition. Know about hair. How does it grow? Hair cycle, shedding, temporary hair loss, permanent hair loss, baldness. Understand that in baldness, the roots become weaker and weaker gradually until they disappear. Understand that once the hair root disappears, no medicine can bring it back and transplantation is the only solution. But when it is becoming weak, as long as there is some life in the root, minoxidil, finasteride, platelet-rich plasma, laser, all these things can work. Understand this. This is the first point. 2. Understand the role of hair transplantation. What can transplant do? Transplant can replace hairs which have gone, which cannot come with medicine. Transplant cannot treat existing hair which may weaken over a period of time. So, unless the patient has lost at least 40, 50, 60% of hair, transplantation is not indicated. Transplantation gives best results when a significant amount of hair, about 50%, is lost. Otherwise, medical treatment is the option. Understand this point. Very important. Also understand, transplant is not a solution for very early hair loss and for very young patients. 18 years, 20 years, no. At least 23, 24, stage 3 baldness. Please remember this. 3. Now that you have understood what transplantation can do, decide whether it suits you, whether you want it, psychologically, socially, emotionally, for betterment of career, for marriage, for profession, and for individual satisfaction. Remember, you have to be fit to undergo surgery. You should not have any systemic illness. So, make sure that you don't smoke. Make sure that your diet is good. You are exercising well. Don't take too many supplements if you are going to a gym. Don't do too much of bodybuilding. Do a lot of aerobics and eat a lot of fruits and vegetables and proteins. Do some yoga and pranayam. All this will help you in the long run because metabolic syndrome is becoming commoner and commoner. This is a syndrome which occurs in young people, or even 25-30, with diabetes, blood pressure, cholesterol, etc. So fitness is also important. This is important. Right. Now point number 4. You have understood everything. You are fit. Next, you decide to do the surgery. Know the surgery. Know that you have to take the hair from the donor area, which is the back of the head, which is the permanent part of the scalp. Then you have to put it to the bald area. You can also take it from the beard, from the face, from the chest, etc. You can also do transplantation for eyebrow, mustache and beard. There are 2 methods. One is the stitch method called FUT, slightly older method. Other one is slightly newer method, FUE, also called hole method, where there is no stitch. Stitch method takes 2-3 weeks to heal. Hole method heals in 1 day. It's an outpatient surgery. You go home the same day. Next day you can work. If you want to travel, next day you can travel. Know this about the surgery, all details. 5. You have known about the surgery, now know about the surgeon. What to know about the surgeon? Check if he is qualified. Check if he is experienced. What is this training? Why am I saying it? Why? Because these days all kinds of people have got into transplantation. Dental surgeons, Ayurvedic surgeons, non-surgeons, non-doctors, anybody is trying to do. There have been 5 deaths because of such people. So know the qualification. Patients should check the recent National Medical Council guidelines. They have specified that dermatologists, plastic surgeons, doctors with training only can do this. So, see how much experience he has, how many surgeries he has done, whether he can do all types of surgery or he can only do one type of surgery, everything. Speaking about our center, I am a dermatologist, a pioneer in this field. I have learned transplantation from year 2000. Dr. Aniket, our plastic surgeon, hair transplant surgeon, has undergone training in many centers and is with us for the last 6 years. Dr. Deeksha, head and neck surgeon, has been with us for 3 years. So you have 3 different specialties here. So know your surgeon. That is the next point. Number 6, know the center where the surgery will be done. Very, very important. Why? Because recently all types of clinics, beauty clinics, salons, spas have started doing surgery with no facility. Remember, hair transplantation is a local anesthesia surgery, but it is still a surgery. As I told you, there are 5 deaths after transplantation in India. 2 people have lost eyes because surgery was done in such centers. Asepsis, control of sterilization, proper protocols, facilities for resuscitation, emergency equipment, facilities for transfer to another hospital, facilities for presence of anesthesia. All these are required to be present as per National Medical Council guidelines which are released in the month of September. Please go through them. It is available on Google. So this is very, very important. 7. You have undergone the surgery. What to expect? What not to expect? Remember, surgery result takes time. After the surgery, the shaft will fall off, will start growing from the 4th month, 1 centimeter a month. Full result is seen by 9 to 10 months on an average. It may be a little later or it may be a little earlier. Please understand this. And remember, if you have existing hair, they need to be preserved by taking medicines. So for this, medicines are also important. Don't think transplantation is the only solution. And also remember, diet, stress-free life, avoiding smoking, exercise are also important. This is the next one. Point number 9. Follow up. Please follow up with the doctor properly. For proper treatment of medicines, assessing your health, assessing your fitness, and need for continuous drug administration. Extremely important. So, regular follow-up if you are in the city, physically, if you are outside India, virtually. Very important. And number 10, last one, most important. Don't fall prey to spurious, misleading, exaggerated, false advertisements. This is as per the ethical guideline of National Medical Council. Unlimited grafts, unlimited density, stem cells, 8 rupees per graft. Please don't believe in them. Don't compromise on safety. Don't sacrifice health for the sake of a cheaper transplant. If it has to be done as per standard guidelines, if it has to be done by a qualified doctor, it will have its cost. Remember, you are seeking beauty. You cannot compromise health. And these days, beware of 2 things. Ghost surgeons who come from somewhere whom you don't see, they do it, go away, you never get to see him, either before surgery or after surgery. You get to be seen by a BBM graduate. Not acceptable. Beware of black marketing, cheating. All that is happening in hair transplantation. 8 rupees per graft, not possible. you will be cheated. Remember how the grafts are counted, how it is calculated, everything has to be transparent. So final message, choose the doctor properly, choose the time of surgery properly, choose the center properly, be safe, take care of your health and acquire beauty and enjoy life. Thank you very much.